Today is day 4 in my series about free and accessible wellness tips for mental health. My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of lifestyle interventions for mental health. And a lot of these concepts do align with wellness culture, but I also recognize that most of wellness culture is not affordable or accessible to everyone. Today, we're going to talk about sleep. Now, sleep is hugely important for mental and physical health, and it's something that so many people struggle with. Now, wellness culture might tell you need to buy this supplement, or you need to get this fancy mattress, or you need to get this special eye mask that will go through a guided imagery or play restful sounds. Whatever. They're going to try and sell you something, but it's totally unnecessary. I'll give you a few tips that are almost guaranteed to yield some improvement in your sleep. One is going to be sleep restriction. This means limiting the time that you're spending in bed to only like an 8 to 10 hour window overnight for when you are going to be sleeping. So this means no napping during the day, no hanging out in your bed watching TV or doing work. The bed should be only for sleep and sex, and you should only be in it when it's time for those things. This might be rough if you're someone who's used to napping, or you have like a reverse sleep schedule where you're sleeping during the day and you're up at night. But trust me, if you get through that pain in the beginning, it's totally worth it. Number 2 is going to be caffeine. Do not have any caffeine after 12 p.m. This doesn't just mean coffee and energy drinks. It means caffeinated soda, caffeinated tea. 3 is going to be screens. Turn off the screens. Ideally when it's dark out, but understandably that's not achievable for some, but at least for the hour before you want to go to sleep. And the reason behind this is that screens emit a blue light that is going to trick your mind into thinking that it's daytime. Now, of course, you could get like blue light filtering glasses. That's those like red and orange glasses you see people wearing sometimes. But again, this is probably unnecessary. You could just turn the screen off. Another is trying to limit your eating window to when it's light out. This is going to help sync your circadian rhythms because we're meant to be up, active eating during the day and sleeping, resting, digesting at night. Of course, like where I live during the winter, we only have about 7 hours of daylight. So unless you want to have a really narrow eating window, then that's not always possible. So I just recommend kind of trying to have an earlier dinner and not snacking after that. And lastly is getting outside in the morning for some early morning sunlight, ideally between 30 to 60 minutes of when the sun rises. This is again going to help set your circadian rhythms. You can get the same effect with a light therapy lamp, but of course this isn't free. It's going to cost you at least $25 for a cheap one, a lot more for an expensive one, and the sun is free. So that's what I recommend. If you have other sleep tips that have been helpful for you, I'm sure there are people on here who could really benefit from it. So please share in the comments below. Wishing you all good mental health today, and I'll see you in the next one.